Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Robin sequence, also called Pierre-Robin syndrome, also called Pierre-Robin sequence. The Robin sequence is a fast arch syndrome. So, the Robin sequence is a faster syndrome, means that it is a fast branchial arch or fast pharyngeal arch syndrome. Robin sequence occur independently or with other syndromes. It may be caused by genetic or environmental factors. Triad of Robin sequence. What are the components of the triad of Robin sequence? Micrognathia, that means small mandible, cleft palate, there will be gap in the center of the palate extending to the posterior aspect from the anterior to posterior in the midline area. There will be a cleft in the palate. We call it cleft palate. Glossoptosis, that means posterior displacement of the tongue. Tongue will be relatively large and it will be displaced posteriorly. So micrognathia, small mandible. There is a gap in the median line of the palate, and there will be posterior displacement of the tongue. These three forms the triad of Robin sequence. Robin sequence may occur when the chin is compressed against the chest in case of oligohydramnios. Oligohydramnios is a condition when the amount of amniotic fluid is less. So baby is very much flexed, neck is flexed, neck is touching the chin, and the tongue will be in between the palatine and between the vertical palatine shelves. The palatine shelf would be unable to contact together, so the arch-like palate will not be produced. Okay, so because of the flexion of the neck, especially in case of oligohydramnios. This is one of the mechanism for cleft palate in case of Robin sequence. Tongue is obstructing the fusion of the two palatine shell to join horizontally in arch-like fashion. The relatively large tongue may cause respiratory obstruction, especially in supine position. Robin sequence, Pierre-Robin syndrome, is first described by Dr. Pierre Robin nearly 100 years back in 1920. Sequence occur in approximately 1 in 8,500 births. Robin sequence may be associated with Stickler syndrome. That syndrome includes the visual problems, hearing problem, and joint problem, or velocardiofacial syndrome that may be associated with that of the head and neck anomaly and also cardiac anomaly. Robin sequence may also be associated with that of the Treacher-Collins syndrome or may be associated with that of the DiGeorge syndrome. So Treacher-Collins syndrome and DiGeorge syndrome may be associated with Robin sequence. Complication, psychosocial difficulties because appearance will be different, mandible will be small. Feeding and speech difficulty, we need special milk bottle for feeding the baby. Malocclusion, collapse of the maxillary arch because maxillary arch is not supported by the mandibular arch. Mandible is small. Missing teeth, supernumerary teeth or both. Treatment, surgical treatment through multidisciplinary approach, like we need a pediatric surgeon, an orthodontist, a periodontist, a dental surgeon, a oromaxillary surgeon, and we need the help of a genetist and person who deal with the speech. So it is a teamwork. Surgery is essential and that surgery should be done during infancy, there should be genetic counseling, because if one sibling has Robin sequence, another sibling may have a few percentage more chance to get Robin sequence than the general population. If the first degree relative has Robin sequence, the second degree children should have more chance to get Robin sequence. So genetics is a factor, plus environment like oligohydramnios, excessive flexion of the neck, and decreased amount of amniotic fluid are factors for the developmental Robin sequence management by surgery, by teamwork. And that's all about the Pierre-Robin syndrome or Robin sequence or Pierre-Robin sequence. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.